HIV and AIDS are both sexually transmitted infections. They are also known as STIs.
Within Australia, there is approximately 27,150 people living with HIV and AIDS.
24% of people living with HIV and AIDS are between the ages of 15 to 24.
The rate of newly diagnosed HIV/AIDS infections has risen by 10%, and in 2014, 1,081 people were diagnosed with HIV/AIDS.
HIV is also known as human immunodeficiency virus. HIV is a virus that causes AIDS. These two viruses are very similar but are not the same thing.
HIV weakens or breaks down the body's immune system and makes the body vulnerable to disease and infection. Some people who have been infected with HIV experience flu-like symptoms, but others do not notice them until many years.
AIDS are not the same thing as HIV. A person living with HIV does not necessarily have AIDS, but all people with AIDS are HIV positive.
AIDS can occur after many years of damage to the immune system caused by HIV.
Risk-taking behaviours associated with HIV and AIDS can include the use of tobacco, alcohol, pharmaceutical or other illicit substances. These are some of the most common types of risk-taking behaviours.
Illicit drugs can be harmful to the body. Binge drinking also has the potential to cause irreversible harm.
Drugs and alcohol can cause the brain to function differently. The substances are able to change the way you think, which can lead you to making bad decisions or choices.
An example of a bad decision made while under the influence of alcohol or drugs is engaging in underage, unsafe, and uncommitted sexual activity.
Unsafe sex at any age can result to an unplanned pregnancy or the transmission of sexually transmitted infections like HIV and AIDS.
These signs and symptoms, other symptoms can include rapid weight loss,
reoccurring fever,
extreme and unexplained tiredness,
diarrhea that lasts for more than a week,
loss of the mouth, anus or genitals,
pneumonia,
memory loss, depression and other neurologic disorders.
HIV and AIDS are both very highly contagious and is transmitted when blood, semen or vaginal fluid from an infected person enters the body of an uninfected person. This can happen through unprotected anal, vaginal and oral sex.
HIV is treated using a number of medicines to resist the infection. This is called antiretroviral therapy, ATR. ATR isn't a cure, but it can control the virus so that you can live longer, a healthier life, and reduce the risk of transmitting HIV to others.
Support services allow individuals who are suffering from HIV and AIDS to receive counselling and other help services that will assist their recovery.
Some support services for individuals suffering with HIV and AIDS are RedAware,
Indiegogo,
Advocates for Youth,
and National Youth HIV and AIDS Awareness Day.
Thank you for watching our presentation.
And remember, sharing isn't always caring.
HIV and AIDS can't be cured by Band-Aids.
And that getting laid isn't worth the HIV and AIDS.